Thank you. And Dr. Caplivski, I usually go by Danny to me, but I'm going to call you Dr. Caplivski here. For the folks that are listening, there's a few Spanish speakers. You want to just give them a quick welcome? I know you have a bilingual background yourself. So
un placer estar con ustedes. Mis padres son del Perú. Somos de una familia peruana judía, por eso el apellido Caplivski. Ellos dos son médicos. Mi papá era cardiólogo, mi mamá patólogo. Estudiaron en Lima y después vinieron a los Estados Unidos para terminar todos los entrenamientos en Cleveland, Ohio, donde yo nací. Y pasé casi toda mi infancia en Florida y después llegué a Nueva York a terminar los estudios. Y aquí, como médico, yo estoy a cargo de los pacientes que tienen infecciones. A veces vienen a la oficina para vernos cuando no están tan enfermos y por ejemplo, tienen infecciones crónicas como HIV y les damos las medicinas para controlar el HIV y ayudamos a prolongar las vidas de ellos, obviamente. Y después también en el hospital estamos viendo los pacientes que han tenido infecciones comunes como bacterias y problemas de catéteres que se infectan, por ejemplo, por diálisis. Pero a través de todo este año también hemos visto muchos pacientes con COVID, pacientes que han sido con síntomas más o menos leves y también pacientes con síntomas mucho más severos y con infecciones críticas, ¿no? O sea que tenemos esa experiencia de todo el espectro de COVID y estamos muy felices que ahora sí tenemos esta opción de la vacuna y estoy feliz de estar con ustedes para tratar de conversar un poco más sobre los detalles de esas vacunas.
Awesome. Thank you so much. So we're going to have Dr. Juan Robles should be joining us as well in a few minutes. I'll make sure he has a chance to introduce himself. He's coming over from another meeting, but he's a physician at Montefiore Hospital. So let's get right into it. So before we talk about the vaccine in more detail, want to emphasize, as I think most folks know, but really emphasize that COVID-19 still is a risk. It feels a lot like we're opening back up. The CDC just said we can, for certain reasons, we can stop wearing masks outdoors if certain criteria are met. And we're seeing a lot more opening up. I know restaurants, for example, will be opening even later, starting next month. But could you just share a little bit of why we need to make sure that we recognize that this is still a risk and we still need to take this seriously before we transition to why the vaccine?
Yeah, so I think first, definitely there's a lot of good news. A lot of people are getting vaccinated in the United States as a whole, in New York City and New York State specifically. And as that number increases of people who are vaccinated, the number of transmission events or infections is going to start to decline. It's still a problem for us in the hospital. We still have a lot of people that have COVID. We still have a lot of variants of the virus that are more contagious and stickier onto the receptors that allow them to enter cells. So we still have to be vigilant. Unfortunately in the hospital, we still are seeing this kind of more prolonged wave of infections, even among younger people. I'd say spring of last year, there was definitely a much more predominance of older patients coming into the hospital. And now, unfortunately, we're starting to see more younger people who need the hospital because they're short of breath and need oxygen. So there's definitely a lot of good news. And if you've gotten a couple doses of vaccine and you're 2 weeks out, the CDC has come and said that it's okay when you're outdoors to take off the mask, and especially if you can distance yourself. But when we're not in those scenarios, and especially when we're indoors and when we're around other people where we don't know their vaccine status, it's still important to take those precautions.
Great, thanks. And so the way out for a lot of us, given where it is out, is a vaccine. That's how we're going to get out to this. So we wanted to move to talk about, right now we know that there's 3 types of vaccines, and if you could help kind of explain what the current situation is in terms of the vaccine and what the different options are.
Yeah, I'm so glad that we have these options. I look around the world at so many countries, including Peru and other places where people are from, where vaccine access is just very limited or almost non-existent. So I think we're very privileged. That's the first thing to know, that we have these great vaccines and we have the options. So Moderna and Pfizer are very, very similar. They're based on a technology called mRNA, where it's a genetic sequence of the virus that's injected into our arms. Like I got the Pfizer around December, and those require 2 doses for maximum efficacy. They're very well tolerated. I would say most people, it's a bit of sore arm. There are some people that have, a more significant reaction with fever, or they feel like really tired the next day and they kind of have to take a day off of work. So that does happen. But I would say most people, it's a sore arm and, you're over it within 24 hours and that's about it. The Johnson & Johnson technology is based on what's called an adenovirus vector. So it just means that we're using a special virus that can't copy itself inside of us, but it delivers the genetic material that we're interested in getting into the cell so that we start making protein. We make spike protein. And the spike protein is what our antibodies are too, and that's what really protects us against getting infected. So that one has the advantage that it only requires 1 dose instead of 2. It can be stored at temperatures that are not as cold as Moderna and Pfizer. So it's a very convenient one for when we're going out to the community, to homebound patients, for example, who can't come into the vaccine pods, and we can go out to them. And we know that with 1 dose, they get good protection as well. So all are great options. So I would say if you're given a choice, which most of us aren't, it's just kind of you show up at a vaccine center and they have what they have. Anyone you can get is great. They're very, very effective and good protection. And by good protection, I mean that in the studies, they'll quote things like 95% efficacy, which means that it's a very, very reduced chance that you would get infected by COVID. It's not 0, and we've certainly seen people getting COVID, especially between dose 1 and 2 of the Pfizer or Moderna. So I would say even if you got that first dose, you still have to be careful about your mask wearing and everything like that. But once you're a couple of weeks past the second dose, you make very, very strong antibodies, and you're very, very unlikely to be getting an infection at that point. And the people that do get infected after a couple of doses of vaccine, no one has needed a hospital or no one has died in all these big studies. So I think that's the important message too, that even if we've got variants to worry about and everything, even if you were to get COVID, you're not going to end up needing a hospital if you've been vaccinated.
Thanks for all that information. One question that's coming up more broadly than also specifically to one of the vaccines. So is there any risk to taking any of the vaccine? And specifically with Johnson & Johnson, we know it was on a pause for a little bit of time. Could you explain that for us a little bit, and if folks should have any concerns if they're offered the Johnson & Johnson vaccine? And then more broadly to all of them, are there any risks to them in terms of taking?
Yeah, that's a great question. So the Johnson & Johnson vaccine is similar to a European vaccine, one that was used in Europe called AstraZeneca. And so what's similar about them is they both use this adenovirus vector. So it's a virus that's actually of chimpanzees, but it's been designed so that it doesn't copy itself, and it's a good, efficient way of delivering genetic information. So the problem was that when they look back, in about 1 in a million doses, there was maybe an association with this potential clotting problem called CVST, which is a cerebral venous sinus thrombosis. It's a long name for basically potential blood clot that can occur in the brain. So it's a very serious issue. One of the questions is how closely is it linked to the vaccine? There is at baseline going to be some people who are at risk for this condition. We think because they make antibodies maybe to the adenovirus vector, where there's somehow their immune system is stimulated in that way. There is a factor in their system called platelet factor 4, and maybe they're making antibodies to that. So I would say that the overall picture here is that it's a very rare event, like 1 in a million, and that the risk of COVID in our community at present is a lot higher than the risk of that very rare event, in terms of the Johnson & Johnson. So that's why the CDC and the FDA put a pause. They said, let's take a look at the data a little more closely. And then they decided, based on this very rare event and the fact that COVID is in very high circulation in the community, we should restart using that Johnson & Johnson vaccine. When they looked back at the studies, there were a few risk factors that were a little bit helpful to elucidate, meaning the people who tended to get those the thrombosis events were younger. They tended to be more frequently female. And they basically none of those events happened in people over 50. So, that's also, I think, sometimes useful information if you're thinking about it and you are over 50, certainly at higher risk for COVID disease, being serious. Your risk from the COVID Johnson & Johnson vaccine is very, very low for many of these thrombotic events. So that's specific to Johnson & Johnson. Moderna and Pfizer are very safe, so I should explain mRNA is a very unstable type of genetic material, meaning it doesn't last very long, and that's part of why we have to keep it frozen at such cold temperatures. And that's good news for us because it gets injected, we make some protein, we make that spike protein and develop antibodies, and then it kind of goes away and gets just dissolved into cells. It never makes it to the nucleus. And I always like to address some of those concerns that come up on online forums. I think sometimes people worry about could this give me cancer? Could this lead to infertility? And the answer is no to both of those questions. None of this genetic material gets into our genome. There's no effect on fertility or anything like that. So I think the main things that people are experiencing are some pretty intense arm pain in some people, and some people, they definitely, after the second dose of Moderna or Pfizer, will be making a very intense immune response. And so they're going to feel really tired, and they're going to, have to take a day off from work or from school.
Yeah, thank you. I know in terms of side effects, after I got both of my doses, I got the Moderna and had definitely was achy and felt a little sick, a little feverish, but that went away after a day. It was really actually the first day or the next day, the first 24 hours was the worst for me. And that's what I've heard from a lot of people. I want to bring in, so Dr. Juan Robles just joined us as well, and I want to welcome him, give him a chance to quickly introduce himself, and then maybe Dr. Robles, what Dr. Caplivski was just talking about was why these different vaccines are so effective, but also addressing some of the concerns around whether there's any risk to taking a vaccine. And I was wondering, maybe, Juan, if you could introduce Dr. Robles, could you introduce yourself, and then maybe in Spanish, reassure those that are worried about any risk.
Yeah. Well, thank you, Andrew. Thank you, everybody, for coming today. My name is Juan Robles. I am a family doctor here in the Bronx. My clinic, I'm actually in clinic today. I was seeing patients today. My patients come here to the clinic at 1 Fordham Plaza, so some of you are familiar with this area. And I've been having a lot of conversation with my patients about getting the vaccine. So I have a lot to tell you, a lot of stories. People want it, some people don't want it. So I would love to share some of those concerns. Andrew, you say you want me to say it in Spanish too? I would just want to make sure.
Yeah, if you don't mind just sharing it in Spanish, especially about what we were just getting into, about are there any potential risks? Should people be hesitant about taking a vaccine?
Sí, gracias por la oportunidad. Yo soy el doctor Robles, como acabo de mencionar. Soy un doctor de familia aquí en el Bronx. Mi clínica está en 1 Fordham Plaza y pues en los últimos meses se imaginan tanto que hablar con mis pacientes sobre la idea de ponerse la vacuna o no. hay muchas muy buenas razones para ponerse la vacuna. Increíblemente la tecnología que se ha usado es muy avanzada comparada con otras tecnologías que se han usado anteriormente para otras vacunas. Estas vacunas son muy, muy especiales. Se hizo un tiempo récord porque ya estas tecnologías se han desarrollado a través del tiempo y los científicos han podido diseñarlos de una forma que son seguras. Para hacerte una comparación, esta vacuna se realizó en varios años, pero en el último año se desarrolló un nivel que se hizo pruebas muy rápidas y se demostró que son seguras. Mis pacientes que las han usado aquí en mi clínica han tenido muy pocas reacciones, y las reacciones que se han mencionado en esta conversación son las típicas. Dolor de músculo donde se pone la vacuna, claro, la inyección duele. Algunas personas desarrollan, no fiebre, pero como ese sentimiento de que tiene una fiebrecita por ahí. Entonces, esa es la misma reacción del cuerpo a la vacuna. Algunas personas tienen un poquito de dolor de cabeza, un poquito de fatiga, pero eso se va en 1 o 2 días. Cuando yo me puse la vacuna en diciembre, sentí dolor mayormente muscular en el área de la vacuna. Yo creo que es una de las mejores vacunas que hemos tenido en los últimos años, ya que se ha demostrado que totalmente provee la protección hasta de un 95% en muchas de las personas que se la han puesto. Eso es excelente. Para hacerte una comparación, las vacunas de la influenza que usamos todos los años usualmente tienen una efectividad del 75%. Estas vacunas que se han desarrollado para el coronavirus tienen un 95% o más de efectividad. Son muy buenas, así que estoy dispuesto a compartir con ustedes qué es lo que mis pacientes han dicho y qué es lo que quieren, los que no quieren y los que quieren. Tengo muchas historias. Go ahead, Andrew. I just shared some.
Awesome. Yeah, thank you so much, Dr. Robles, for that information. So before we move on, we're going to move on in a minute to how to get the vaccine, where to get the vaccine, and we're going to go on to the questions that I know a bunch of students and guests and everyone watching have submitted already. Before we do that, one more question for you. I know, perhaps for a younger audience, but really for everyone, they're wondering, okay, I don't feel like there's a big risk to me for COVID, and I don't know about, I might be a little concerned about the side effects or inconvenience or risk. So what are the other benefits to get them? And I'll just say up front, I know we've had some complaints about the quarantines for our team when one person tests positive and the whole team has to quarantine. So I know there's a benefit for that in terms of quarantine for those that are vaccinated. But Dr. Caplivski, do you want to take this one to start, and then Dr. Robles can add on?
Yeah, I mean, I just can't wait to be able to go to a concert event or, any big crowded event and show my Excelsior pass and say, I'm actually going to be able to enter this event. So I know, for young people especially, I think the COVID pandemic has been so tough, because this is a time when you're used to being with your friends, you're used to being at events where there's a lot of people around you, and you've kind of been robbed of that this whole year. So I think that, one of the big advantages that once you've gotten vaccinated, you've gotten your 2 doses, you're 2 weeks out, New York State has an Excelsior pass, which is essentially like a vaccine passport, so that, let's say you want to go to a concert this summer and, you want to be able to get in without getting tested. Those are the kind of things where if you're showing this vaccine pass, you're going to be able to do that. So, beyond the obvious health benefits of protecting yourself from severe COVID, which, in younger people is rare, I think just the ability to return to a normal social life is going to be a huge plus for all the young people, in SBU, all your games, if you think about all the big professionals, they're all getting vaccinated because they can't afford to miss a game to COVID, and I know this is such an important sport to all of you, and I feel like that can be a motivation too. It's just once you're vaccinated, the chance of you having to quarantine or be out, from a game are very, very small.
Thank you. Dr. Robles, do you want to add anything onto that?
Yeah, I'll do a little bit in Spanish. Claro, los beneficios de ponerse la vacuna son increíbles. Casualmente este fin de semana pasado fui al primer juego del NYCFC en el Bronx y que imagínense, pidieron prueba de vacuna y mi esposa y yo teníamos prueba de vacuna y fue muy fácil entrar al estadio y sentirnos seguros de esa manera sabiendo que la mayoría de las personas en el estadio tenían ya la vacuna o habían demostrado que no tenían infección del coronavirus. También se necesita para viajar a otros lugares. Creo que lo más importante de vacunarse en nuestras familias es de que protegen no solamente a uno mismo, pero a los demás. Entre más estemos vacunados en la casa, mayormente va a ser mucho más fácil de interactuar con mis familiares, con mis amigos. Sabemos que las personas que están vacunadas y van a querer salir al parque, por ejemplo, ahora las nuevas reglas han cambiado, las guías dicen que en el parque ya no vas a tener que usar la máscara si estás vacunado y si las personas que tú estás también están vacunadas. Así que hay muchos beneficios. Ahora mismo se están vacunando a todos los adultos, comenzando desde 16 años en adelante. Y básicamente yo creo que aquí todo el mundo tiene 16 años, me imagino, o más. Pues la recomiendo mucho para usted y su familia, básicamente.
Thank you. Thanks so much. So we're going to come back to this. I'm sure there might be more questions. What I want to go on to is how to actually, who's eligible and how to get the vaccine. So I know we have a lot of young folks on the call right now, and we have parents and others. We're at a great stage right now that everyone 16 and older is eligible to get the vaccine. Do you want to add anything on to that? And then any tips in terms of the best way to get the vaccine, where they should go to make sure that they can get vaccinated?
Yeah, I just wanted to share what it was like. You all remember this, but in December, when this was just starting to happen, and healthcare workers were the first in line, along with first responders, and I just remember in our hospital, there was a buzz. Everybody was like, "How do I get this vaccine?" Like everybody really wanted to get to the front of the line because it was we were right in the middle of our winter COVID surge, and everybody was feeling it. So it was very restricted. It was hard to get. There was not enough supply out there, and I think the difference now is that the supply is really solid, and it's much easier to get a vaccine. A lot of my patients are going through Vaccine Finder through New York City and New York State. We have a vaccine pod at Mount Sinai as well, which we can share the website on I'll put it on the chat. But it's basically our whole lobby in the spring of last year became patient area because we needed the bed space, and now it's all become vaccine area. So there's vaccine pods in our lobby, and it's just so encouraging for us to see that every day we have more and more patients coming through getting vaccine. That's going to make a big difference, and that's going to mean the end of this pandemic. So New York City and State Vaccine Finder, and then Mount Sinai's website has a big vaccine page as well.
Thank you. Dr. Robles, any tips to add on to that?
Básicamente lo mismo, que la vacuna está disponible ya por toda la ciudad, mucho más fácil que antes. En diciembre y enero era un gran problema porque tenían que hacer citas la mayoría de los pacientes, usar la tecnología era un poquito más complicado, pero la mayoría de los pacientes del Bronx han podido hacer sus citas usando sus teléfonos, la computadora. Las abuelitas usan a sus hijos, a sus ahijados, a sus sobrinos para que les hagan las citas, y ahora mismo ya ni necesitas hacer citas por la internet y puedes entrar a varios centros sin cita, así que mucho más fácil para los muchachos jóvenes también mucho más fácil usar la tecnología.
Great, and if thanks so much for sharing that in Spanish. If there's anything you want to add in English that Dr. Caplivski didn't cover to make sure people hear that, feel free to do so as well. I did want to add as well that a little fuzzy, but anyone can actually just walk up to any city-run site without an appointment to get a vaccine, correct? And I think we have these up on screen here. So for any of the students out there or anyone, definitely use a vaccine finder that both doctors recommended. But if you're having trouble getting appointments, any of these locations up here, and there's a whole list of them across the whole city of places where you can walk up, including the American Museum of Natural History, which I heard is the hottest vaccine site in the whole country right now. Isn't that right?
Yeah, I saw you could get a vaccine under the big blue whale, which is a very cool place to get it.
Awesome. So, big difference than a few months ago when we had a hard time getting these appointments. I know I was hitting reload every moment to try and get my appointment. But just to re-emphasize for everyone, that's not the case now. It's very convenient, very easy. You should get your appointment or just walk up to one of these sites. Anything either you want to add in terms of getting the appointments and before we go to questions?
Yeah, I'll just, in terms of logistics, most of it, it's, I would say also very short wait times. I think in the past we had big lines and, it was really hard to actually get through. But they're very streamlined now. They're giving you a vaccine card when you leave, so you're going to have your own record of this actual vaccine. And they're registering it with the Department of Health at the state, so that there's going to be in all your medical records. They'll be able to find it, and when you want to sign up for the Excelsior Pass, the New York State is going to have the record of it, so you're going to be able to get into all those, concerts or whatever you want to do later.
Y quiero añadir que en los centros logísticamente hay mucha ayuda. Si te presentan un centro de eso, te van a ayudar en tu propio lenguaje, te van a ayudar a llenar la aplicación si tienes que llenar una. O sea, se ha facilitado todo para el proceso. No quiero que te sientas intimidado por presentarte y que no vas a entender lo que está pasando. Las instrucciones son bien claras y hay mucha gente ayudando. La cita, por ejemplo, si tienes que tomar una segunda dosis, dependiendo de la vacuna, la cita te la van a dar ahí mismo para la segunda dosis, no tienes que hacer el proceso nuevo. Todo facilitado.
Great, thank you. So I think what we're going to do is we're going to go to Q&A, and we have a whole list of questions that have been submitted already. We have group of students, I think our 10th, 11th graders are going to have to leave in a few minutes, so just chance. So I want to give them a chance before I go to any of our preset questions. If there's any 10th or 11th grader that's going to be leaving in a moment and wants to ask a question, just put up your hand and I can unmute you, or you could type in the chat and we'll make sure to cover your question. If there's any burning question you want to get answered, please put that in now. Everyone else will be staying on, but 10th, 11th graders will be leaving in just a moment. So while anyone gets up the nerve to put up their hand or put a question in the chat, I'll go to one of the first questions. And one was a pretty specific question. What side effects occur after the vaccine for those who have various pulmonary ailments?
Good. So I just say that people with pulmonary ailments should not expect any kind of different side effects than people who don't. So if you have asthma, if you have emphysema, or any kind of problem with your lungs, there's no additional side effects, and you have another reason to want to get this vaccine. Because with COVID, you're definitely going to have a worse time if you get infected, if you have asthma, or if you have emphysema. So it's all on the plus side of getting the vaccine.
Correcto. Todos mis pacientes que han tenido asma, no ninguna complicación, están protegidos. Ellos tienen mucho riesgo, las personas con enfermedades pulmonares. No he visto ningún efecto secundario en los pacientes míos que se han vacunado.
Great, thank you. Is there any 10th and 11th graders that want to get their question? Let's see any hands go up yet. I'll go to one more question before we let them go. I think we answered this about the vaccine. Now that Jonathan Johnson is back on again, is there one that you recommend? Is there anything else you want to add there?
I mean, people ask me that a lot. I've just been telling people whichever one you can get, go for it. There is a slight difference in efficacy between Moderna, Pfizer, and J&J. And it just, in some of it has to do with when the studies were done. and where they were done. So J&J was kind of done in a period when more of the variants were already circulating. So they had a slightly reduced protection, but it's really pretty marginal. It's not a big difference. So, and for some people, a single dose vaccine is just more convenient, and they know they've done it. And for that reason, it makes a lot of sense. So whichever one you can get, I would say go for it.
Great. And one question just came in before I let them go. Is there any side effects if you have allergies to certain things?
Yeah, well, I would say that there were some more serious side effects in people who had allergies to components of this vaccine, specifically polyethylene glycol, which is kind of just a preservative. So for most people, that's not an issue. And even if you have really bad seasonal allergies to the pollen, like I have terrible pollen allergies, I didn't have any terrible vaccine side effects or adverse events. We are just kind of watching people for 15 to 20 minutes after they get their vaccines to make sure they're not short of breath or having any serious side effects to the preservatives.
Correcto, de acuerdo. Todos mis pacientes que tienen historial de alergias, de cualquier tipo de alergias, se han vacunado y también lo único que hacemos es monitorearlos un poquito más tiempo, entre 15 a 20 hasta 30 minutos en algunos lugares. Pero no ha habido ninguna complicación severa.
Great. Well, thank you so much. We'll let the 10th grade, 11th grades go. Before I do so, just want to emphasize, hope you know the age, if we don't get it enough, is 16. So if you're 16 years old or older, you should make sure to get your vaccine appointment. Certainly consult with your parents, but make sure to get the vaccine. If you have any questions, Dr. Caplivski and Dr. Juan Robles are both here to answer any of those questions that you have, and we can definitely share. I'm not being too forward, but I can share their contact information with you or your parents if they have further questions. Both of them can answer any questions in Spanish as well. For 10th, 11th graders, before you log off, make sure to go to your band session to get your regular tutoring link. It's already on there, and then you can go directly to tutoring from there. I know the 12th graders are staying on. So 12th graders, seniors, and then anyone else that's listening, we're going to keep going. I'm just letting the 10th and 11th graders sign off, get to their tutoring sessions that they have right now. So you all can go ahead. So as they're signing off, I think we're going to continue with a question. And there is one question on the chat in Spanish. I don't know if Dr. Caplivski or Dr. Robles, you can read that. I don't want to butcher the question myself. I'm going to let the Spanish speaker take that if you see that and can address it.
Por supuesto, la pregunta dice, tengo una pregunta, dice, ¿la vacuna es recomendada para la persona con anemia y asma también? Definitivamente sí, no es ninguna contraindicación. Como habíamos mencionado, asma también es una condición pulmonar y es un gran beneficio para estos individuos que tienen ese tipo de condiciones. Anemia es una condición hematológica de la sangre y no es ninguna contraindicación para usar la vacuna. Así que definitivamente no hay ninguna contraindicación.
Great, thank you. And I just want to quick clarification for the seniors on the call. You're staying for another 7-8 minutes until 6:45. So there's that confusion. Again, any 10th, 11th graders, you should be signing off or getting to your tutoring session right now. But we're going to make sure you get all the answers to all these questions right after. And Dr. Robles, the question that he addressed was, is vaccine recommended for someone with anemia and asthma or both? Asthma or both? And I think the answer was yes, you should still get it, correct?
Correct.
You have even more reasons to get it.
Mm-hmm.
Yeah. Like that's especially if you've got asthma, you should be first in line for this,
Awesome. Well, we're going to continue with the questions. I have one that just came in, chat, and says, if you have a cold, I think this is a common theme, but if you have a cold, is it a bad idea to get the vaccine? Is there any complications there if you have kind of a common cold?
So a couple of things. One is that the vaccination centers want to make sure that nobody coming in has COVID. And believe it or not, that actually happens kind of regularly. People don't realize they have COVID. and they're coming in to get their vaccine, and then a day or two later they start feeling a little bit of fever, and then they get cough, and they think it might be the vaccine. This just happened to me with a patient who said, my vaccine, the next day I was feeling really like muscle achy, and I started coughing, and then I said, you know what, let's test you, and he was positive for COVID. So what's happening is people are getting exposed right before they get their vaccine. And it's not a real problem in terms of any severe side effects from the vaccine. You're not going to get worse COVID. You may actually get a little protection. The problem is all the people around you at the vaccine center. You're wearing a mask, they're wearing a mask, but we're trying to limit the amount of events because these are going to be, by nature, a lot of people in a large space, but in a fairly closed space where there's not a lot of air circulation. So if you are feeling sick, the vaccine is not going to harm you, but we're asking you to wait until you're 100%, so you get your vaccine and you're not going to get it while you're having COVID and maybe spreading that to other people.
Awesome. So here's a question. Does getting the vaccine protect you from getting the virus? Well, we answered that. And will it protect you from getting the virus if you had it before? So I think the main part of this is if you've had COVID already, how does that interact with having the vaccine?
Yeah, well, we still recommend getting the vaccine. So a lot of the antibody studies that are done look at how long those antibodies last, and they're pretty good. Once you've had COVID, it's pretty good protection, and it's fairly rare for us to get COVID more than once. But the truth is, this is all still so new that we're still learning, and it's very possible that we're going to see more and more events where people had COVID, but then they get exposed to a variant virus, meaning the COVID virus has mutated a bit, and they may be able to get infections more regularly. So that's why we're definitely recommending everybody, even if you had COVID or you think you might have had it, you're not sure, still get the vaccine because that guarantees that you're going to have that protection.
Es una excelente pregunta. La pregunta básicamente es si tuviste el virus, deberías de vacunarte. La realidad es, como explicó el doctor, estamos aprendiendo mucho sobre la protección que ofrece al haberse inmunizado naturalmente. Una inmunización natural es cuando uno está expuesto al virus, se desarrolla inmunidad, anticuerpos naturalmente. Casualmente, una paciente que yo hablé hoy, ella tuvo el coronavirus en marzo del año pasado, desarrolló anticuerpos, estaba positivo para los anticuerpos, la protección que desarrolló. Este pasado mes yo le volví a hacer el examen de anticuerpos y ya no tenía los anticuerpos, estaba negativo. Quiere decir que esa protección natural que ella desarrolló se disipó, ya la perdió. Estamos aprendiendo mucho, entonces no sabemos cuánto tiempo esos anticuerpos van a durar. Mi recomendación para ella es que se vacune para que desarrolle anticuerpos de nuevo al coronavirus.
Great. Thank you. I hope that answered the question for everyone. Sounds like it did. There's a question in the chat now. This is a good one, but I know neither of you are public policy experts or government officials. You're medical professionals. But the question is, in a few months from now, will it be mandatory to be vaccinated into certain areas or certain tourist attractions or even schools? Do you have any perspective or thoughts in terms of where things are going in this regard?
Yeah, it's a good question. It's something we don't always know because those are decided at the level of the state. But certainly, if you think about vaccinations that are already required, like measles and influenza and a lot of these things, there is a pattern where schools can require those vaccines for enrollment. And they always put in religious exemptions and potential medical conditions that are a contraindication. But yeah, I'd say it's going to be a status thing. You're going to want this vaccine status to be able to get into things that you like to do, and it may become mandatory for some of those type of events too.
De acuerdo, una situación complicada por ahora porque nos estamos aprendiendo de la vacuna y de las leyes y todo esto, pero el historial de nuestra nación dice que la mayoría de las vacunas en este país, eventualmente todo el mundo tiene que utilizarla de alguna manera u otra para ir a la escuela, para ir a la universidad, Creemos que lo mismo va a ocurrir con la vacuna del coronavirus, que va a ser una necesidad y algunos empleadores tal vez la requieran para poder participar en las actividades de trabajo o de escuela. Así que, pero hay muchos más beneficios que eso.
Yeah, thank you. We're going to have to wait and see on some of this. So it is about 6:45. I think we're going to let the seniors go in just a second. They're going to sign off. I do want to get one before, if possible, before they go, because this gets to some of the concerns about hesitancy, why some of them aren't. Some people might not want to. And what is how in the world did it take such a short time to create this vaccine to this virus? If they couldn't possibly be safe if they did so fast. So if it's possible for the seniors, I want you to hear this before you get going to your session.
Yeah, I'd say short answer is money. Okay, guys. So normally, vaccine research and development is very, very expensive. And the companies that make these vaccines are taking a big gamble because they're trying to develop a vaccine against a disease that, maybe affects a subset of people, but not the whole planet. And they've got to make a 10 to 15-year commitment just to develop maybe like a protein that they could use in animals. And then they got to go to humans. And then if it works, if it's safe in humans, then they got to do a bigger trial. And they spend, hundreds of millions of dollars. And so the pace of that is very slow, mainly because of the issue that they're taking a lot of risks and they're just not sure it's going to pan out. What happened with coronavirus is that the whole planet had a very vested interest in making sure we had a vaccine for this. And we were desperate for it, everybody. So governments put a lot of money up front that said, okay, even if your vaccine doesn't pan out and it doesn't work, we're going to guarantee that your investment in the research is worth it for you. So the companies all just poured their resources and everybody was working night and day just to try to get this out in time that we could actually be using it to where we are today. So, we're so fortunate we live in this very wealthy country and we have access to amazing resources. We've got 3 licensed vaccines now. The FDA process that they followed was the same that it would have been for all the other vaccines we use for chickenpox, for pneumonia, for measles, all these vaccines that we use. It just was had so much financial backing behind it that they could do it in a much faster way. So that's my short answer to that very good question.
Thanks. And yeah, so just to stress, your first answer, money, right? So for students, want to ensure you heard that answer and make sure understood why this is safe. We again encourage you all. I know all our seniors are over 16, so I encourage you all to make sure you get the vaccine, speak with your parents, guardians, family members, but really encourage you all to get that vaccination. So our seniors on the call, I know have to head over to their college prep session right now. Make sure you join a link. I think it's on your band as well. If you don't know where to go, join that link, get over to your college prep mentors. They're working on their college scholarships right now. But get over there, and I hope this was really helpful, and we're looking forward to getting you all vaccinated. For everyone else, we're going to stay on for another about 10 minutes, 12 minutes, until 7 o'clock to wrap up with any additional questions they have. I know we have a bunch still coming in and still on slides. So I'm going to go through the slides here. I think we have a few more. Let's go through that. So this is a good question. If you've been fully vaccinated, why take any post-vaccine safety precautions? So even if you're, maybe say you've already said it's 2 weeks, I think it's after 2 weeks you should be fully vaccinated. Not the day after you get your second dose, but after 2 weeks you're considered fully vaccinated. But why should you still take post-vaccine safety precautions, wearing a mask, and washing your hands, and everything that we've been hearing about for the past year plus?
Yeah, that's a really important question for our whole community. So what the vaccine studies did is they looked at prevention of disease. And what does that mean? People getting sick with COVID, people going to the hospital, people dying. All those things were prevented with this vaccine to the tune of around 95%. The problem is they weren't really studying infection. And what do I mean is, even if you've gotten 2 doses of the vaccine and you don't get sick, there's the chance you could still have some of the virus replicating in your nose. And that means you can spread it to people around you, especially people who haven't been vaccinated or people who've gotten the vaccine but their immune systems are weakened because of cancer or transplants or other things. So they're still at risk. And I think it's important to recognize that, that we're in this together, So while the vaccine is a good safety measure for you, and it's unlikely you get very sick from COVID, we're still in a time when you need to do those safety precautions for the people around you.
Dr. Robles, you want to add on?
Sí, es una pregunta muy importante para la pregunta es ¿por qué seguirnos usando estas medidas de precaución aún cuando los hayamos vacunado? Muy buena pregunta. Estamos aprendiendo mucho de cómo funciona este virus, la infección, la transmisión. Hemos aprendido de que sí, las formas de higiene han sido las mejores formas de precaución. La vacuna va a ayudar mucho más, pero las personas aún vacunadas, como mencionó el doctor, existe la posibilidad de que aún tengan el virus replicándose en sus fosas nasales y transmitir a otra persona. Creemos que eventualmente esa información va a ser más sólida, se va a conocer más. Ahora mismo están cambiando las guías y ya se está recomendando que estás vacunado y los que están vacunados alrededor tuyo ya puedes quitarte la máscara aunque sea fuera en un espacio libre. Así que estamos aprendiendo mucho. Por ahora recomendamos que siga precauciones para ayudar a los demás y proteger a los demás.
Thank you. So here's another relatively specific question, but something a lot of people are thinking about relates to what we were just talking about. What if everyone is fully vaccinated? I think we're talking about getting together in a gathering, but maybe one person's high risk even after they're vaccinated. Can we still gather indoors without that? What is your perspective on this?
Yeah, I think the good news is that, let's say it's a family event, right? Everybody in the family has gotten vaccinated and it's a Thanksgiving dinner, for example. But, one person in the family has a weakened immune system because they've got cancer or they went through chemotherapy. And that I think that even if that person, let's say it's your grandma, who's just not going to make as strong an antibody response as everybody else, even if that person's a bit more susceptible, the fact that everybody else in that room has been vaccinated makes the chances that anybody is going to actually be transmitting virus a lot lower. So then we start getting to the threshold when it's probably okay to not wear a mask, even if you're in a family gathering all together.
And Dr. Robles, you could take this if you want. It's a similar type of question, but specifically about kids. Now our kids don't have kids under 16 don't have the vaccine. So what about that? If we're gathering and everyone is vaccinated, but except the kids, are there risks involved there? What should we be considering until all the children are able to get vaccinated?
Perfecto. La vacuna aún no se recomienda a los de edad de 16 años o menos porque no se han hecho estudios de vacunación con esa población. Pero sabemos que los niños y las personas mucho más jóvenes tienen una inmunidad mucho más diferente, digamos, a las personas adultas. Como has podido notar, la mayoría de las personas que se han complicado de la infección del coronavirus son las personas más de edad avanzada, ya que el sistema inmunológico de esas personas es mucho más débil. Los jóvenes, los niños tienen un sistema inmunológico diferente, son más fuertes, y el coronavirus en realidad no causa muchas complicaciones como en los adultos. Esperamos que algún día podamos vacunar a todos los niños también.
Yeah, I'll just add to Dr. Robles that I agree. The kids, fortunately, have not gotten, for the most part, severe complications of COVID. There's, a few exceptions where they get this post-COVID inflammatory syndrome, but it's pretty rare. So that's great news. But yeah, the studies from Pfizer and Moderna are coming. They're working on kids younger and younger in terms of proving the vaccine safety and efficacy. So I think in the next few months we'll probably have access to that. In the meantime, I do think it's okay if we're in gatherings where all the adults are vaccinated and the kids are not. Again, because right now our main focus is preventing the severe disease among the adults.
Great. Yeah. thank you so much. I heard that individuals under 15 are a huge proportion of our population. So we're not going to reach our herd immunity until children are able to also get the vaccine. So hopefully you're right. We're just a few months away. Okay, so this is all the questions we have on the slide. So I'm taking off share. We'll be able to see everyone for a second. But there is a few more questions that have come in, and feel free in our last 5 minutes to put anything in the chat, or if you're watching Facebook in the comments, so we can make sure we get your question these last 5 minutes. One that I have here is, how long does protection from COVID-19 last with the vaccine? For various things, that once you get the vaccine, are you going to need a booster, or is it only going to last a few months, a year, forever? What are your thoughts on it?
Yeah, I've spoken with some of our virologists at Sinai who are looking at these questions. How long is that vaccine immunity going to last? And I think the answer is probably it's going to last a lot of months, but that we are probably going to need boosters, in part because of the nature of these variants, the way that the virus is mutating and changing. It's becoming a little stickier to the receptors. It may be harder for our antibodies to really neutralize the virus or block it from entry. So I think it's likely that we're all going to be looking at a booster sometime in the next coming months. Maybe it's a year out. Maybe it's going to be a little bit like flu, where right before the cold months, we end up getting our COVID boosters. The other point I wanted to make was just regarding blood tests, because a lot of people ask me about getting a blood test after the vaccine to confirm immunity, and it's just a caution that sometimes the blood test that commercial labs is looking at nuclear protein, so it's not always that spike protein. So even if it's a negative test in the blood, just feel confident about if you've gotten your 2 doses, you should be good. But yeah, I think boosters are probably going to be needed for all these vaccines.
De acuerdo. Creo que vamos a necesitar vacunas periódicamente para darle ese booster, como le llaman.
Great. Well, thank you for that. I think it's been really, really helpful. I'm just trying to see if we have any other questions that come in that have not already been addressed. I think one maybe is mostly been addressed, but if you have a weak immune system, any concerns with that in terms of getting the vaccine?
Yeah, no real safety concerns. I would just say there's some concerns on efficacy. So what that means is the vaccine's not going to cause you any problems if your immune system is weak, any different than it would to someone who has a normal immune system. But you may not mount as high level of antibodies as, let's say, someone who doesn't have cancer or who doesn't have a transplant or something like that. So in that sense, it's good to be aware of, maybe you're taking a little more precautions with masking, especially when indoors, even if you've been immunized. So I think that's a group of people where we're going to have to look at a little more carefully as a lot of the other social distancing precautions, start getting lifted.
Agree.
Great. Well, thank you. We're in the home stretch. So I just want to give you each any last message that you want to leave for anyone watching here. What last message would you leave them with in terms of the vaccine and where we are today?
I just want to say thank you to SBU. I think what you're doing is so important. Like for years, it's an incredible community organization, and this message I think is really important. I think SBU is made up of a lot of kids who come from a lot of countries from all over the world where these kind of vaccines are just not available. So I hope people will think about it as a privilege that we have in this country, that we actually have access to these amazing vaccines that are real lifesavers. So I think, just kind of keep that in mind. It's normal to have a bit of hesitancy and doubts about anything that's new, but just trying to keep that perspective, I think, helps as well.
En mi opinión, yo creo que es la juventud la que va a poder lograr con ayudar esto, porque primeramente tienen la sabiduría de tecnología, pueden ayudar a sus familiares, tienen la información al alcance para poder ayudar a otros, Así que son súper inteligentes, saben cómo manejar el iPad, el telephone numbers, and all those things. So ayuden a sus familiares y también vacúnense ustedes mismos.
Great. Well, once again, thank you both so much for spending an hour with us this evening to share all this really incredibly helpful information. I hope that everyone that was with us today and is still watching and might watch this in the future, make sure to go get your vaccine if you haven't already. It's so important for the health of our community and the South Bronx, but the whole country and really the globe. So the information you've all shared is really important. If anyone does have further questions, you're watching this later and you have any questions, you can always add it on the Facebook chat, but also you can reach out to us directly. We'll make sure to put you in touch either directly with the doctors or the right resource if it's something we can't answer. And you can email us at info@southbronx